Welcome, welcome, welcome. Hello, everyone. Come on in. Let's get it started. All right. Glad to see you here today on this lovely Friday morning. We are going to have an opportunity to hear from our experts today about the health benefits for CalPERS medical plans, as well as the health benefits unit. I'm going to ask everyone to please remember to keep your microphones muted while we're in the presentations, and hold your questions. Your really pressing ones you can actually put into the chat. If the representative has an alternate person that can answer your question, they will do so. Because this is a public forum, and we're streaming it, we would caution you strongly to be mindful of what personal and private health as well as financial information that you share in this open platform. Some of the representatives, you can ask if there's a possibility to speak to someone one-on-one and not in a group setting such as this. So just, shoot a text message, a chat message to them if need be, to see if you can arrange something of that sort. Yeah, but other than that, kick it off with Blue Shield of California. We have with us today Alex Garcia, and he is the account representative for Blue Shield of California. So, Alex, would you please take the mic?
I am happy to. Thank you, Katrelia, and thank you so much for giving me this opportunity to speak about the CalPERS Blue Shield of California benefits. What I'm going to do is going to give you a quick overview and highlights of the Blue Shield plan, but I'd like to mention that Blue Shield is dedicated to providing has a mission of providing a health plan that's worthy of your friends and family. And so we do this by making our plans coverage flexible and making sure that we provide customizable care plans that are appropriate for you and your loved ones. So what's new for 2023? So we do have some expansions. We have the Trio Blue Shield option. So we are expanding to new counties in Kern, Riverside, and San Bernardino. So if you are located in any of those areas, you will be happy to know that you have an affordable health plan with the same benefits that you get with your Trio Access Plus plan. And I'm going to talk about the slight differences between the two in just a few minutes. Now, you'll see here that as you look at your healthcare options, Blue Shield is offering you Trio HMO, Access Plus HMO, and the Blue Shield Medicare PPO plan. I'm not going to go over the Medicare PPO plan because that deems a whole presentation by itself. But if you are considering retirement, you might want to look into the PPO Medicare plan as an option. As you look at the comparison between your two non-Medicare plans, this is Trio HMO and Access Plus HMO, you'll see that you have comparable benefits. You see that your copays for many of your medical services the same. So you'll see here that you have both plans offer the chiropractic and acupuncture service. You have Teledoc that is available to you. This is a service where you can video conference or a phone call a real physician that's able to provide medication prescriptions to you. And these are available on demand. So they are available 24 hours, 7 days a week. And you'll see here that you have mental health benefits provided on both plans as well. The difference between these two plans really is the network. So you have Access Plus HMO, that's a full network provider plan. And you have Trio HMO, which is a smaller network and available in the counties that I mentioned and more. And I'll dive into that just a little bit more. So as you look at the screen at the bottom, you see that you see the counties that I've mentioned that will be new in 2023. In addition to those, we have Los Angeles, Orange County, Riverside, as I mentioned, Santa Barbara, and Ventura. So those highlighted at the bottom are what you'll be able to, you'll be able to see coverage under your TRIO HMO option. Now, TRIO offers, like your Access Plus plan, virtual care options. You have self-referral to specialists within the same medical group as you do with your Access Plus plan. And it also includes the Shield Concierge service, which is a great service that I really encourage all of you to take advantage of, because it is more than just a member services line. This is a concierge service where you can call. And when you do get connected to a representative, they know exactly what your benefits are with CalPERS. They know how to help. They can look into your medical history. They can provide you access with many programs that are available. If you're looking for wellness programs, they'll be able to get you in touch with a wellness coach. So in terms of TRIO HMO, I mentioned that it's not available everywhere. In Los Angeles County, I'm going to focus on that because being that LACCD is part of in Los Angeles County, I'm going to show you really quickly the providers that are within this county. Not going to spend too much time on here, but I wanted to give you a quick view of where it's available. And so you'll see the way it's listed there on the screen. You have your medical providers or medical groups on the left-hand side and your hospitals that are connected with those medical groups on the right. And so here is the last of the list. And then I'll talk a little bit about Access Plus. So Access Plus is one of the largest networks of doctors, specialists, and hospitals in California. So you'll see from the map there, what you see shaded in blue is the areas where Access Plus is made available. There are no deductibles and co-insurances on the plan, as you saw from the summary before. So you're looking at the robust benefit package that's available with a broad network plan. And you have the pharmacy benefit included on both plans. You'll see the major pharmacies listed on the screen. So if you're wondering what they are Albertsons, Costco, CVS at Target, Safeway, Vons, Walmart, and so many more. And if you're looking for a pharmacy locally, you can go onto our website, blueshieldca.com/pharmacy, and you'll be able to find in-network pharmacy locations. And if you're interested in learning more about the Blue Shield plan and our coverage in regards to pharmacy benefits, if there's a particular medication that you're currently receiving and you'd like to know what if we cover it, you can go into our Blue Shield formulary list and you can download a list of covered drugs, or you can go into very detailed specifics and you can enter the name of the prescription and it'll tell you the coverage and whether or not it's on our formulary. And then virtual care options. Both plans offer virtual care options. You have a nurse 24/7 service. So if you'd like to get consultation on minor injuries or illnesses, you can speak to a nurse, a registered nurse, or you have the option also of chatting. So if you prefer to type in your questions, you can do that with a registered nurse. I spoke a little bit about the teledoc service. This is also a service that's available 24 hours, 7 days a week. And as I mentioned, this is a real doctor on the other line that you'll be able to phone or have a video consultation with. These services are at no cost to you. So it's a great service for you to be in touch with your doctor or a doctor. And in terms of prescription drugs, as I mentioned before, you have that service, but you also have included your mail service program. So you save up a copay, and there's no additional charge for shipping. So free shipping, and you get 3 months of medication for only 2 copays. Behavioral health is included on your plan designs with Blue Shield. You'll see there on the screen the services that are available to you. So if you're looking to get help for any stress, depression, anxieties, or any other services related to behavioral health, we have a program and a medical professional that's there to provide you that service. And Wellvolution, that's our wellness program. We have additional resources and help that are available online. So if you're looking to lose weight, manage your weight, maintain, or if you're looking for help with exercise, or if you'd like to be able to de-stress and have more of a stress-free, reduced stress environment, we have a great app there with Headspace, and that's an application that's available to you to help you accomplish that. And then lastly, I just want to direct your attention to our online resources. If you need to look up a doctor, you're considering Blue Shield as an option, and you want to find out if your doctor is within our network, you can go into our website and use the Find a Doctor feature. It'll tell you your doctor, whether or not your doctor is in our network, and the medical groups and hospitals that they are affiliated with. And if you'd like to have more information regarding our plan beyond today, we do have virtual options. You can see a recorded presentation like what I'm doing here today. And you can also schedule a one-on-one appointment with me if you need that additional help beyond today's open enrollment meeting. So I really appreciate all of you. Thank you so much. Looking forward to seeing you in the breakout room or chatting with you online. Thank you. Thank you, everyone. Katrelia, I hand it back to you.
Thank you so much. Okay, so with that, we're going to have another brief presentation by Anthem Blue Cross. Wendy Franco and Tammy Rowe are here, and so would you please take the mic?
Thank you so much, Katrelia, and thank you everyone for joining us again this morning. All right. And I also want to say that I am going to move through some of these slides a little bit quickly because, as you know, we have both HMO and PPO plans. The wellness and additional programs that are piggybacked onto your medical benefit plans are very much the same. So if I move too quickly through the slide on the HMO presentation or on the PPO presentation, it's because we've already looked at it and it's going to have that same information. So with that, let's go ahead and take a look at what we're going to be doing. All right, so we're going to look at choosing your plan, which is either the select HMO or the traditional HMO offered by Anthem Blue Cross. Using your plan, we're going to have a quick look at the health and wellness programs, and then of course how to enroll, tips and additional tools. So for both our H1 PPO and any other Anthem member for that matter, we do offer extra support for COVID-19. We have added extra resources and benefits to support your needs, of course, and you can get that additional detail on COVID-19 resources at anthem.com/CA/coronavirus. Okay. Now, with both of the plans, again, PPO and HMO, before choosing your plans, you're really going to want to consider your personal situation. Of course, we want to listen to our friends, their experiences and things like that. But really, ultimately, it comes down to what is your personal situation? Have your healthcare needs changed? Do you go to the doctor more often or less now? And of course, are you taking prescription drugs? We know that the pharmacy benefits are built into the medical plans. Again, both HMO and PPO. They are administered through OptumRx. And you're going to want to take a look at the cost comparison. Guess what does that monthly payment look like? What are the copays, out-of-pocket maximums, et cetera? So with our HMO plans, of course, you're going to have that primary care physician or PCP. You and your eligible family members on the plan do not have to enroll in the same medical group. So if you have different needs than your spouse or domestic partner or your children, you can go to different medical groups, and you can even choose a pediatrician for your PCP for your children. Okay, of course, HMO plans, the costs are very straightforward. You know what the low copays are. There's no deductibles. Preventive care is covered at 100%. And you're not going to have to worry about those claim forms. You're just going to have those copays. Okay. If you are with another carrier other than Anthem and you're considering moving over to Anthem, we do offer that continuity of care. So if you're already in a course of treatment, you would want to call our prior authorization line, and then we can also reach out and help you to potentially continue with your current care team if that's something that is needed. And then, of course, we'll certainly help you transition to your new health plan and your new care providers. If you have members who are out of area in another state, so say you want to be on the HMO plan and you're thinking, well, I have kids that are going to be going to school out of state, I have to be on a PPO. That's actually not correct, because we do have an exclusive agreement with CalPERS for that guest membership program. So we can get not just that urgent and emergency and follow-up care that would always be available no matter what plan you're on, no matter where you are in the world. But if you have members on your plan, or even you, that are going to be away from home for more than 90 days, we can reach out to our away from home guest membership program. And we're going to look at that in a future slide, and it'll give you a little bit more detail on it. But we can connect you with that primary care physician and primary medical group. So that way you can stay on that HMO plan, and then also have your dependents who are out of state get coverage as well for be above and beyond that urgent and emergency and follow-up care. We can actually get them set up with that medical group and get their annual physicals and things like that. We know that you guys are primarily in the Southern California area. So you are offered both our Select HMO and our traditional HMO. The difference between the Select HMO is the access to a narrow network of doctors. So there's a fewer to choose from as medical groups in that Select HMO, but it does offer a lower monthly premium. Our traditional HMO does provide access to the full HMO network, but it does come with that higher cost. For those of you who, again, because you guys are in Los Angeles and Ventura counties, primarily in Orange counties maybe, we do have an exclusive network under our Select HMO, which is, again, that lower monthly premium for members who live in Los Angeles and Orange counties. Have an exclusive network which is Vivity, and we're going to look at that in a future slide. So certainly consider that. And again, these are the benefits across the board, Select HMO and traditional. You have office visits, referred specialists, urgent care, and the acupuncture and chiropractic care, which is covered at a $15 copay. Chiropractic and acupuncture, you do get 20 visits per calendar year. You can use them as you see fit, whether you use all acupuncture, all chiropractic, or a combination of both. The emergency room copay is $50, which is waived if you were to be admitted. And then what's great is that hospital, outpatient care, lab tests, preventive care, all covered at no cost to you, no copays, no deductibles, no nothing, as long as you're staying within the network, of course. Again, remember, the pharmacy benefits are included and administered by OptumRx. So here's where we have our Select HMO network. It's kind of snapshot. Again, we're just going to look at the southern region right now. If you guys have additional questions or want more information, pop it in that chat and we can go ahead and address it, or we can go to that breakout room and look at the Q&A and address it there. So if you did want to look at that full inclusive list, you would want to go to anthem.com/CA/CalPERS. Okay. And I really encourage you to take a look at that Select network, because again, with our Vivity network, it really brought together, it was a partnership with us Anthem, and 7 of the top-rated health systems in Southern California, which you guys, again, I'm sure you're already very familiar with these names. Cedars-Sinai, Huntington Hospital, Memorial Care, PIH Health, Good Samaritan Hospital, Providence, Torrance Memorial, and of course, UCLA Health. Okay, so again, you're going to have the exact same benefits you would have on that select HMO plan and the traditional HMO plan. It's just an exclusive network specific for members who reside in Los Angeles and Orange counties. That would be the network that you would be utilizing if you were to sign up for that select HMO. If you have questions, you can always reach out to one of our dedicated customer service teams. That would be 855-839-4524 for our HMO plans. You want to let them know that you are not yet with Anthem. If you are not yet enrolled with us or signed up with a plan, let them know it's open enrollment, which of course they know that, but let them know that you're calling to get information, and they can help you kind of decipher through that information as well. If you are a member, of course, you can give them that information and let them know that you want information on other plans. Here's where a lot of the programs that we're going to look at very quickly are applicable for both our HMO and PPO plans. Okay, you're going to be able to access your health plan information online and also on your smartphone. They both are online, and our Sydney Health mobile app utilize the same login, username, and password. So you're not going to have to worry about multiple logins and things like that. And with both of those applications, you're going to be able to find care. You're going to be able to search for doctors, look at medical groups. You're going to be able to check your benefits, claims, access plan documents, and even connect with our member services. You're going to want to definitely access your digital ID card as well. So when you're scrambling, trying to find that ID card, right, you're not going to have to worry about it because you're going to have access to it not only on your phone when you're there, but also you can log in prior and go ahead and print it out and take that with you. This is that Sydney Health mobile app, of course. Again, everything's going to be in the palm of your hand. Everything that we just looked at that's available online and on your phone. What's great that we're introducing this year is the Alexa with Anthem skill. So what you're going to want to do if you do have an Anthem plan is that you can go to the skills and games in the Alexa app and search for Anthem skill. You're going to click on enable to use. Again, same username and password you're going to use to log in online and through your Sydney Health mobile app. You're going to use the exact same one for this. And then you're going to be able to utilize that voice activated access. So for example, Alexa, ask Anthem to email me my plan membership card. Or Alexa, ask Anthem to find a family doctor near me. So it's, again, going to give you that hands-free, voice-activated ease of use. So I encourage you to go ahead and get that set up. And that way, when you need it, you're going to have it already ready to go. Our Life Health Online offers that convenient care from home. It's going to give you access to a board-certified doctor in the comfort of your home 24/7. It's also going to give you accessibility to set up counseling sessions with a licensed therapist psychologist. For if you're feeling depressed, anxious, stressed, really kind of a whole 360 view of any health issues. It's going to be at the comfort of your home. If it's late on a weekend, if it's in the evening and your regular doctor's office or urgent care is not open, this is going to give you that great option if it's not a medical emergency. And all you need to do is have a smartphone, tablet, or a computer with a camera, and they're going to be able to even call in a prescription for you. I've used it many times myself. My health plan also offers this. It's been a really great tool for us. Again, traveling late at night if you got little ones and last thing you want to do is truck them to the emergency room if it's not really necessary, this is a great option for you. Now here's where I gave that information about your coverage traveling with you. So if you travel outside of California, of course, you're going to have urgent or emergency care available no matter where you are in the world, no matter what plan you're on, HMO or PPO, right? You're going to have that worldwide. For an HMO, of course, if you're out of your access area, emergency and urgent care. If you take a trip outside the United States, Same thing. We do have doctors and hospitals in over 190 countries and territories around the world. But again, you're going to have urgent and emergency care, whether they're in our network or not. And if you plan to live in another state for 90 days or more, we have our Away from Home guest membership. You can call them. It's available for you guys today if you're already with Anthem and you have kids that are or dependents that are on your plan that are out of state. You can go ahead and give them a call and see if that state participates in the program. And that's 1-800-827-6422. My Family Health Record gives you that whole person view of your entire health history. Again, with these plans, it's great to kind of get everything all in one place and access everything all in one spot for you guys. Again, that overall picture even offers charts and graphs that track your health data over time and really gives you that full view of all your medical records from all your different care providers. My Health Advantage helps you to stay on top of your health. It gives you just kind of that extra assistance to help keep you on track of your health and progress, reminders. Again, you can also check your claims, tests, checkups, and then you can also personalize things. And it also offers you ways to save money. So who does not like that? I know I do. Our health and wellness programs, of course, it helps you to become more engaged in your health. It can assist with making your healthcare decisions to assess your needs, reach your health goals. And again, saving money on health-related products and services is always top of the list for a lot of people. And after your benefits start, again, go to anthem.com/CA/CalPERS, or you can call the number on your ID card or in the mobile app, and I'll walk you through the steps for those programs. We have our 24/7 nurse line. Again, I'm sure you guys are very familiar with that. Registered nurses ready to help answer any questions, assess symptoms, etc. Now, with our special offers, I know it comes up for members on how, okay, well, where do I find this? Where am I going to see that? So if you do need to be enrolled on an Anthem plan in order to access it. But when you go on, you log in with your username and password, and right on your landing page, you're going to go up to the very top and you're going to click on discounts. And when you do, it's going to be right there. It's going to give you that drop down. It's going to take you right to that page as far as the special offers at Anthem. Our condition care is a dedicated nurse team. Again, these are things that are going to be on both HMO and PPO. So we're going to see these again. The condition care is specific for members with asthma, diabetes, heart disease or heart failure, COPD. It's going to give you that support from dietitians, health educators, and pharmacists. Future moms, if you enroll within, while you're pregnant, if you're looking to start or grow your family, you can go ahead and contact the Future Moms program at 888-613-1130. Our diabetes prevention program is partnering with Solera. It's at no extra cost at all. It's part of your health plan, and it's a 12-month, 16-session program that can help you lose weight and lower your risk of developing type 2 diabetes. You can go to the online Solera, that's SOLERA, the number 4, me.com, or you can call them at 855-717-8813 and complete that 1-minute quiz to find out if you're eligible. I'll give you additional information there as well. Our case management does partner with you guys to help answer your questions, coordinate your care with different doctors, and show you how to use your health benefits. As an example, if you have a serious health matter and you are in the hospital, we can get you connected with that nurse care manager to help you with everything from A to Z. We have cancer resources to review treatment decisions, develop a care plan, prepare for care, etc., manage your symptoms. And again, these are for resources for people that have cancer or the survivors and even caregivers. We know enrolling is as easy as 1, 2, 3. You're going to choose your benefit options, submit your plan selections, and of course, we want you to confirm that your information is correct because your health plan does go into effect January 1. We already know the Anthem website that's dedicated for CalPERS, but I want to point you in the direction right here of this online digital magazine. We just got all of our information approved by CalPERS, so you may see 2022 plan information currently on there, but it will be updated for 2023 documentation any day. But I really encourage you, if you're trying to look at open enrollment information specifically, rather than potentially being overwhelmed by the full Anthem CalPERS website, I encourage you to go to this online digital magazine because it is concentrated for open enrollment. And that would be Anthem, the number 4, CalPERS.com. And again, the 2022 information is still applicable and it will be updated shortly with the 2023 information if it has not yet already been done. Okay. So thank you for that. I'm going to switch gears now. Now with PPO plans, we know that PPO plans really give you that flexibility not only for in-network benefits, but also out-of-network benefits. With our PERS Gold plan, again, you see there's 2 PPO plan options for you. The PERS Gold plan is available exclusively for California residents. That said, it does offer your benefits outside of California. You just have to be a California resident to be eligible to enroll in it. And the reason is because we give a subset of our full PPO network within the state of California. And it is a value-based plan. And we offer different incentives and things like that. But again, it offers that full network outside of California, and all of your benefits are also available to you. But it is our least cost plan of the 2 PPO plans. Our PERS Platinum plan is available no matter where you are, nationwide or worldwide. So you're going to be able to enroll in that no matter where you are. And it does offer access to our full PPO network within the state of California. And likewise with PERS Gold, PERS Platinum also offers our full provider network nationwide. And it does offer the highest level of coverage when we look at that side by side. One of the things I want to highlight for PERS Gold members, we offer you ways to earn credits to lower your deductible. And we also offer an extra incentive for our Future Moms program. I know we looked at it in the HMO. Our Future Moms program is available with the PPO, but PERS Gold is the only one that offers the additional incentive. If you enroll in that Future Moms program, if you're looking to start or grow your family, before your 36th week, you will have no hospital deductible or coinsurance when you deliver. So we're going to pay that facility claim for the delivery at 100% for you. Here's the side-by-side. Again, PERS Gold is that least costly premium, and PERS Platinum does offer the highest level of coverage. I'm going to go down to about midway where it looks at the office visit copays, because this is where it's similar side by side, as you can see. Specialists are a $35 copay on both plans. Chiropractic and acupuncture, again, 20 visits per calendar year at a $15 copay. $50 emergency room copay, waived if you're admitted. 100% routine preventive coverage. Pharmacy benefits are included by OptumRx. Okay, and of course, we do offer that out-of-network coverage. We would cover 60% of the allowable amount. You'd be responsible for 40% in everything over and above in a non-emergency situation when you're seeing out-of-network providers. So again, these are the benefits that are similar and or the same down on both plans. So now we're going to bump up, okay? Office visits for PERS Gold. Office visits for all primary care doctors, et cetera, those are also at $35 copay. However, we ask that you designate a primary care physician. And when you see that designated primary care physician, we're going to pay that at 100%, and you're going to have a $10 copay. PERS Platinum, when we ask you to designate that primary care physician as well, come 1/1, it's going to be at that $20 copay. So it's not going to change anything. That's going to be for general and family practice doctors in addition to your designated primary care physician. PERS Platinum has a $20 copay. PERS Gold is an 80/20 plan with a $1,000 deductible and a $3,000 maximum out-of-pocket coinsurance. PERS Platinum is a 90/10 plan with a $500 deductible and a $2,000 maximum out-of-pocket. So for those of you who do not know what that means or how that works, PERS Platinum is an example. So say you go to the you go to the hospital and you have an injury and you're looking at, this is the first thing that's kind of going on the first of the year, right? The first $500 of eligible charges, anywhere you see that 90/10 coverage or even that 80/20, anywhere you see that percentage split or the 60/40 for out of network, it's going to be subject to that calendar year deductible. It's the same deductible. It does combine both in and out of network, but you will be responsible for that deductible prior to any coverage where you see that percentage split. Okay, so say our first claims come in, we're going to apply that first $500 as your responsibility to pay. Once that is satisfied, we would pay at 90% of the contracted rate. You'd be responsible for 10%. That's your coinsurance. And then anything above and beyond that contracted rate up to the billed amount would be a provider write-off. Now, this maximum out-of-pocket, this 10% member coinsurance, anytime you pay that 10%, it's going to go towards that $2,000 maximum out-of-pocket coinsurance. So should you have a lot of things going on, a lot of claims coming in, and a lot of out-of-pocket expenses with that 10%, when that is applied, it's going to go into this bucket. Should you reach that $2,000 with your 10% coinsurance amounts, we are going to pay in-network providers that contracted rate at 100% for the remainder of the year for you. So you really have that safety net. You're not going to be seeing like 10% of a $100,000 bill. You're going to have that 10% up to a maximum of $2,000 after your deductible. We're going to pay our 90% plus the remainder of that 10% should it exceed that amount. And then all your other medical in-network services for covered benefits for the remainder of the year at 100%. Now the deductible, you're going to see it's $1,000 for PERS Gold, but in the beginning I mentioned that there were ways to bring that deductible down. And here are those 5 ways to do it. So all dependents, again, this is referring to children, adopted children, foster children, anyone who is a dependent on your plan, separate from spouse, domestic partners, and subscribers. All your dependents will get all 5 credits, whether they're 5 years old or 25 years old. Okay, so they're not going to have to worry about getting these credits or certifying that they're non-smokers or anything like that. They're automatically going to get these at the beginning of the year. For subscribers and spouse or domestic partners, you guys will automatically get both of these credits on the bottom for the virtual second opinion and the condition care program. Again, we looked at that condition care program on the HMO already. So again, asthma, diabetes, chronic obstructive pulmonary disease, heart failure, coronary artery vascular disease. If you are not eligible for one of these 2 programs, which a lot of people are not, right? We're still going to give you that $100 credit, right? We're not going to penalize you for not qualifying for one of these 2. We automatically give this to everybody. Should you qualify for one of these 2, if you're going to be having a non-urgent or non-emergency scheduled surgery in 2023, we urge you to go ahead and give that number a call, which is that 888-361-3944 about the virtual second opinion program. It's a voluntary program. If you choose not to, you don't have to, but when you have that surgery, we'll take back that credit. Otherwise, it's yours to keep. The condition care, if you choose to opt out of that program, if you qualify, you do not have to participate, but when you opt out, we'll take back that credit. Now, these top 3, we're going to make it very, very easy for you guys. You can do it online. You can certify through the Sydney Health mobile app, or you can even call customer service. So when you have your annual physical and they do that biometric screening from your doctor, we're going to go ahead and give you a $100 credit. If you let us know that you do not smoke, or if you do, you can complete a quit smoking program. we're going to give you another $100 credit. And again, with the flu shot, if you get a flu shot, whether it be at the pharmacy in your plan's network, your doctor's office, if your employer is doing a wellness fair and they're doing free flu shots, things like that, or if you decide not to do the flu shot because of personal reasons, religious reasons, political reasons, what does not matter what it is, give us a call so we can make sure to give you that $100 credit as well. Okay. Again, you're going to have the full access online and on your smartphone for all the same things that we talked about in the HMO, and everything you're going to want to access in the palm of your hand. Our Senior Health mobile app is again with our PPO. The Anthem skill with Alexa is also available, as is our Life Health Online program. Okay, of course, the coverage travels with you. Now, this works a little bit different with our PPO than it does our HMO, but again, I know I covered it in the very beginning, so I'm just going to very briefly go over this. If you travel outside of California, you can have access to our full PPO network on both PERS Gold and PERS Platinum through our Blue Card program. And they can go ahead and it's going to work the same way as it does if you're seeing your providers down the street. If you take a trip outside of the United States, again, we have our Global Core program, but you do not need to go to them because you're going to still have urgent and emergency services worldwide, no matter what plan you're on, no matter where you are in the world. So just know that you're going to have that coverage. The My Family Health Record, this is great for, again, PPOs as well, because with PPOs, we all know we can go to providers nationwide if we want to. This is going to bring all of those things all into one place for you. You're not going to have to piecemeal it anymore. It's going to be in one place. My Health Advantage, again, helps stay on top of your health and keep things on track for you. Our 24/7 nurse line. Same discounts that are great. Once you are enrolled, you're going to want to go and access that. Again, very top, you're going to look at programs and discounts. Our condition care, we looked at this already. And condition care support. So this is something that is new. This is for our PPO, and it is exclusive for our PERS Platinum members only. So this is going to piggyback onto our condition care program, where a registered nurse can help you schedule your doctor's visits and dialysis, manage your conditions, follow your treatment plan, explain how to use your medical equipment, and also find helpful information and resources. So this is back pain, ESRD, musculoskeletal disorder, and vascular disease. Okay. This is our Future Moms program, again, available on both HMO and PPO. Our diabetes prevention program is available on both, and that's the partnership with Solera. And of course, case management and our cancer resources. WellV Surgical Decision Support is for our PPO plan. And this is really going to help you support decisions about treatment, preparing for surgery, and recovering. So this is going to be for both surgical and non-surgical, and really helping you decide if that surgery is right for you or if you want to go a different route on the non-surgical things. And that's going to be at WellVie, WELVIE.com, select register, and you're going to complete those enrollment steps, and it's going to take you step by step from there. So again, enrolling is easy as 1, 2, 3. And with our PERS PPO plans, again, you're still going to have the same Anthem CalPERS website and then the online digital magazine. But our dedicated customer service number, of course, with our PPO plans, if you have questions above and beyond where we are today here, you can always call them. It is 877-737-7776. Again, that's our dedicated customer service team for the PPO questions. So thank you again for having me. And Contralia, thank you so much for giving me the extra time to go over both HMO and PPO plans. I appreciate it.
You're welcome. Thank you so much, Wendy. And so we're going to move now on to our next health plan representative, and that will be Kaiser Permanente. Sunny Smith, would you take the mic?
Great. Yes, thank you, Katrina, and good afternoon to everyone. So I am Sunny Smith, the Territory Manager, and I am going to be discussing Kaiser Permanente. So as many of you already know, Kaiser Permanente is a unique health plan. We are both the providers of care as well as the health plan insurance provider. And that translates to making your life more seamless. We have our doctors, our hospitals that are working collaboratively together to provide you with the best care and treatment. We have our specialists that are integrated with your medical records. So when they're making split-second medical decisions, they have your full health history in front of them. So we take great pride in having that electronic health record. Our doctors make more informed decisions when treating our patients. Also, our referral process is also seamless. So things like seeing a specialist or an obstetric gynecologist or even mental health or any drug dependency disorders, you do not need to seek a referral for those services. Also, we have many ways for you to access care. So we have care available by phone or video, online, and that never takes place of in-person care. So if your preference is to go into the doctor to be seen, that option is always available if that is your preference. And we also have the ability to have our laboratories as well as our pharmacies available at one location, so you can access all of the services that you see on the screen in one location during one visit, saving you time and making your experience more convenient. So I'm going to move on to the next subject matter, and I'm going to talk a little bit about accessing care. So during the pandemic, we were able to make over 11 million 117 million virtual connections with our customer base. We actually have a really large footprint of members with over 12.6 million members that are in our medical group. And that is in the 9 areas that you see listed on the screen. So we're available in California, Colorado, Georgia, Hawaii. You can see the names listed. The states listed, so Maryland, Washington, D.C., Virginia, Oregon, as well as Washington State. We have over 773 hospitals and medical centers within the Kaiser Permanente medical group, and that is, again, within those 9 different regions and service areas. And we've expanded our footprint with our physician network. We have over 23,656 physicians within the Kaiser Permanente medical group. Okay, so we're going to talk a little bit about our service model at Kaiser. So why would you choose Kaiser Permanente? We are the leader in California of providing quality of care to our member and giving an excellent patient experience. We have one of the largest multi-specialty medical groups in the area, as well as I talked about the convenience of care with our digital options. So having your doctor on the phone appointment, video visit, and many times you can make an appointment with your actual primary care doctor. So we're not contracting out these services to another provider. We are providing these services through our own medical group. So you will keep that continuity of your care present when you're seeking care virtually. Also, we have the ability for you to seek advice from your doctor. So you have the availability to email your doctor with any medical related question that you may have. So that service is also available for your convenience. We also have our care management team that's available to help mitigate and care for conditions such as diabetes and heart disease and get you enrolled in any necessary disease management programs. We also have some member perks such as discounts through our Choose Healthy program on things like tracking devices, fitness equipment, massage therapy. There's chiropractic acupuncture already on the plan. We have 20 visits per year of any of those services combined. But if you ever exhaust those benefits, you will be able to go to your Choose Healthy site and get additional discounts on those services. We also have a partnership with ClassPass. So what ClassPass does is it provides reduced rates on things like group fitness. For example, there are several different studios that focus on things like bar, kickboxing, for example, yoga. So if you're interested in any of those perks, we certainly invite you to visit ClassPass. We also have embedded in the ClassPass partnership with Kaiser access to over 4,000 on-demand video visits and workouts to you at no cost as a member. And my personal favorite is Calm. That is our meditation app, and that's available at no cost, and it helps reduce anxiety, stress, and improve sleep. If you are traveling and you get injured or you are sick, we would encourage you to know that you have benefits when you're out of the Kaiser Permanente service area or even out of the country. You would have urgent and emergency services available at on your account. And if you seek those services, you would be able to be reimbursed. So if you're out of the country and you get sick or injured, you go see a doctor, you're billed, you pay that bill, you bring that bill back to your service area, you file a claim, and then we will reimburse you minus any applicable copay charges. So if it's urgent care, it will be $15. And if it's emergency services, it will be $50. But we have a dedicated travel line to help you coordinate all of your care and even get support and assistance when getting the claim filed. And you can visit kp.org/travel for more support. And there's also that number on the screen that we would encourage you to utilize. And that the travel line number is 951-268-3900. And they are available 24 hours, 7 days a week to meet all your travel needs. So also, I'm going to talk a little bit about mental health services. So at Kaiser Permanente, we really are focusing on removing the stigma of mental health. And we are encouraging our members to seek care. Our primary care physicians have questions to see if they think anyone that's coming in for something non-related is a candidate for mental health services. They say the average person takes about 7 to 10 years to actually get help. So we're trying to take a proactive approach to mental health. We have a wide variety of services to treat things like anxiety, major depression, moderate depression, and any autism spectrum disorders. We have psychiatrists, psychologists, family and marriage therapy services available, as well as our medical social worker team. As well as I want to remind everyone that all of these services are available without a referral, so you don't need to get a referral from your primary care physician. We also have some online self-care resources. I talked about Calm, for example, that could help with any of the conditions you see listed, like relieving stress, helping to improve your sleep habits, actually practicing mindfulness and meditation, and other services. You can visit kp.org/mental health to learn more. And then finally, some more information about our member perks. So we talked about ClassPass already, so I will not be redundant there. We talked about our self-care app, Calm. We also have My Strength available, which is a little more comprehensive. That one is a little less self-paced, and it gives you more of a regimen to follow for a prolonged period to help someone that may be having a little more of a severe onset with stress, and they want to do something self-paced to help them on the continual basis. Also, we have our wellness coaching by phone that's available. That's a great resource if you want to focus on losing weight, for example. Our health coach is there to help you build a action plan, and will follow up with you to see what your progress is and give you suggestions to stay on track. So that is a great resource there to provide motivation and support. We also have our online healthy lifestyles programs, which gives information and videos and podcasts about a variety of health topics, including healthy recipes and more. We also have our reduced rates, and I talked about that through Choose Healthy, our programs that provide those discounts for Kaiser Permanente members on things like gym membership, massage therapy, gym equipment, to name a few items, tracking devices as well. We also have our on-site health education classes that are available at our medical centers on subjects like heart disease, how to quit smoking, diabetes prevention, stress reduction, and a number of other topics. We also have convened our seasonal farmers markets. So if you are in certain areas, I know we have on Kaiser Cadillac, as well as the Woodland Hills location, seasonal farmers markets that are back open. And also, just to kind of give a quick rundown for the benefits, I think this was mentioned earlier that all of the HMO plans are structured the same based on CalPERS negotiating it that way on all of the groups we have. But preventive care has no charge for a copayment. So if you're getting any annual physical, that is no charge to you as a member. Your doctor's office visits are $15, and doctor's office would include your visit with your primary care doctor, for example, a specialist, or any urgent care physician. Those are all a $15 copayment. Any lab work, so you get your blood work done, or any other diagnostic tests, that is available at no charge for you as a member. If you're getting an MRI from our radiology department, or X-ray, or a CAT scan, that does not have any copay associated with it, so that's no charge to you as a member. Outpatient surgical procedures, so if you're getting, let's say, a foot surgery and you're getting discharged that same day, that would be a $15 procedural charge that you would pay. Hospitalization, that is no charge. If you go to the emergency room, if you're sick, you would pay $50 for that visit. But I want to give you another scenario. If you go to the emergency room, for example, you're sick and they admit you to the hospital and you stay in the hospital, they will then waive that $50 copay because there's no charge for hospitalization. So you won't pay it if you are admitted. So that will be waived. Just wanted to draw that distinction there. For your pharmacy services, so at Kaiser Permanente, you would get your pharmacy benefits dispensed from Kaiser, unless, of course, you are out of the area and you're, let's say, for example, in another area, you have an urgent care situation. We will allow you to go out of the network for that purpose and be reimbursed. But in the service area, you would go to Kaiser Pharmacy and you would pay $5 for generic medication being dispensed, or for $20 for a brand name medication being dispensed under your retail plan. We encourage you to use the mail order. You do get a copay savings. For a 100-day supply, you would pay the cost of a 60-day supply. So times 2 copayment. So for a generic, you would pay $10, or brand, you would pay $40 for a larger dosage. So there's some copayment savings if you're on qualified maintenance medications. So I would encourage you to look into doing that, and you save a trip to the pharmacy. And then the maximum yearly out-of-pocket is simply there for your protection For individual, it's $1,500. For family, it's $3,000. So I'll just give you a quick example. So this just applies to your copayments that you will be charged. So there's no deductible you would have to pay. So if you, let's say you had 3 different services in the year, so you had an emergency room visit, outpatient surgery, and you went to the doctor. So that would be a total cost of $80. Then that $80 would accumulate to the $1,500 out of pocket, and every charge for that year would accumulate. If you ever reach $1,500, you would no longer pay any co-payments, but most people don't reach that. So just so you're not confused, that's just there for your protection. And then some exciting openings that we want to report. So we now have the Playa Vista Medical Office open. I actually use that medical center myself. We have Claremont Mesa, Hesperia. We also have the Tri-City, and that's in North San Diego County. We also are excited about our 2023 new Watts Medical Center office in the remodeled Learning and Counseling Center that is scheduled to open first quarter of 2023. And then finally, San Marcos Medical Center has been in the works for quite some time. That will be opening in the fourth quarter of 2023. And that is all I have. And I invite you to come to the breakout sessions for more information and questions. Thank you.
First off, my name is Sandy Cisneros. I am the UnitedHealthcare account manager. And as a CalPERS member, UnitedHealthcare is one of your medical health plan options to choose from. So today, I'm happy to provide you and help you understand your UnitedHealthcare HMO medical benefits, tools, and resources. And once again, for questions, I know we will be able to answer them after the presentations and during the Q&A breakout sessions. So for specific or personal questions, I do ask that you please call our dedicated customer service number, which will be provided at the end of the presentation. So let's get started. So knowing your benefits helps you make more informed healthcare decisions. As a member, you'll receive tools and support to help you save time and money and find care when you need it. UnitedHealthcare offers 2 HMO plans to choose from. We have the Signature Value Alliance and we have the Signature Value Harmony. I'll go over some of the details and benefits you can expect so that you can expect to choose and understand your UnitedHealthcare plans. For the Alliance HMO plan, it's available in 26 counties throughout California. It's an original health plan offering with a distinct subset of UnitedHealthcare network providers who collaborate on your care and help you manage your health. You can choose from over 35,000 physicians and 250 hospitals. Coverage outside of California, HMO service area includes virtual visits, emergency, and urgent care only. Please go to uhc.com/CalPERS for a full list of doctors and hospitals. The Harmony HMO plan is a design network available in 5 counties throughout Southern California. You can choose from over 17,000 providers and 175 primary hospitals in LA, Orange, Riverside, San Bernardino, and San Diego counties. Coverage outside of California as well. HMO service area include virtual visits, emergency, and urgent care only. Now let's go over your HMO medical benefits. You can easily search for a provider on our website as well at uhc.com/CalPERS. And the reason why I brought that up really quick is because for the Alliance and Harmony HMO plans, they require each enrolled person to select a primary care provider from the plan network. If you need to see a specialist, your primary care provider will need to submit a referral, and referrals are not needed for OBGYN, chiropractors, and acupuncturists as long as they are in the network. Coverage is available only when you use a provider in the plan network. If you use an out-of-network provider, you'll be responsible for the entire cost of the service, The exception is emergency and urgent care, which are covered wherever you are. When it comes to paying for network care, here are some examples of basic costs. There are no deductibles or co-insurance. Preventative care is covered 100% in our network. The copay for a primary care provider and specialist visit is $15. Emergency services have a $50 copay, which is waived if you're admitted to the hospital. Chiro and acupuncture is also included, so you can receive 20 combined visits per calendar year at a $15 office visit copay. For full coverage details, see your official health plan documents, which can be viewed and downloaded at uhc.com/CalPERS. OptumRx is your UnitedHealthcare plan pharmacy benefits manager. It is committed to helping provide you with easier and lower cost ways to get the medication you need. If you choose to receive your prescriptions by mail, you could get up to a 3-month supply for 2 copays and save a trip to the pharmacy. If you have questions about pharmacy benefits, please be sure to contact OptumRx at 855-505-8110, or you can go onto the website and put in OptumRx.com/CalPERS. Searching our network is easy. If you have a primary care provider, make sure they're in our Alliance or Harmony network before you visit them. There are a few ways you can search our networks. Look for the Search for a Provider tab on the uhc.com/CalPERS website to use our online search tool, where you can search for physicians by name, specialty, or zip code. You can also download a copy of our Find a Doctor guide for step-by-step instructions there. Or you can also contact our customer care advocates at 877-359-3714. A virtual visit lets you talk to a doctor by video or phone 24/7 without an appointment for common conditions like the flu, coughs, infections, and more. These services have a $15 copay. With virtual visits, doctors can diagnose and treat a wide range of non-emergency medical conditions. And if appropriate, they can also send a prescription to your local pharmacy. The UnitedHealthcare virtual visit providers are Optum, Teladoc, Amwell, and Doctor on Demand. Members can learn more or start a virtual visit by going to uhc.com/virtual visits or uhc.com/CalPERS. Supporting you in your emotional well-being. UnitedHealthcare is using virtual technology to help expand access to behavioral health care. Members can seek care from providers in person, virtually, or a combination of both. Get connected to self-help digital tools, behavioral health providers, and other resources that can also help with a variety of concerns such as depression and anxiety, relationship difficulties, alcohol and drug use recovery, meditation, mindfulness, stress relief, and so much more. So for more information on your behavioral health benefits, visit our website or contact our customer care advocates. As part of your wellness resources, you also have support to help you lose weight and keep it off. Real Appeal is an online weight loss program designed to help you lose weight and keep it off. The Real Appeal program includes an online coach for encouragement so that you can create a healthy, lasting change, a success kit with a digital weight scale, food scale, recipes, fitness equipment, and more. You'll also have access to motivational resources to set goals, track your progress, and stream workouts using your online dashboard. Simply Engage. Integrated with Rally, Simply Engage is an innovative, simple digital wellness program designed for you to take control of your health and have fun earning rewards at the same time. It connects you to a personalized health recommendations, content, and resources tool. When you complete certain health and wellness actions, you'll earn rewards up to the maximum for that reward. Covered employees and covered spouses or domestic partners can earn up to $200 in gift cards and rally coins. Available tools and programs also include health survey and videos, biometric screenings, coaching programs, rally missions, and gym check-ins. Visit uhc.com/CalPERS to learn more about Simply Engaged. UnitedHealthcare is committed to adding the other types of variety which pertain to health and wellness options. So as part of your benefits, the Peloton app is available at no additional cost to you. UHC members get a 1-year Peloton digital membership. It includes thousands of fitness classes, flexibility to get active anywhere, anytime, and ways to help you have fun and stay motivated. To learn more, go to uhc.com/Peloton. Our customer care team is available by phone to help answer any questions you may have. You do not need to be a UnitedHealthcare member to call and ask questions about our benefits. You can scan the QR code with your phone or visit our website at uhc.com/CalPERS, where you will find all our benefit information and more. If you have specific or more questions, please call our dedicated customer service line at 1-877-359-3714. They will be happy to help. Thank you for allowing me to present your UnitedHealthcare plan options. I hope this information was helpful. This concludes my presentation. Thank you, Katrelia.
Okay, we're going to move quickly now to HealthNet. Let's get her to take the mic. There we go. Perfect.
Thank you. My name is Teresa Kenny. I am an account coordinator with HealthNet. I support the CalPERS team. And today we're going to go ahead and quickly go over the HealthNet plan. With the HealthNet plan, you earn rewards for improving your health. We have a custom website and social media tools to help you manage your health. Why choose HealthNet? HealthNet is an HMO plan like the other plans that are offered to you. We've been in business for over 40 years, and we've supported Californians through the various stages of life, and that's what we want to continue to do. With HealthNet in Los Angeles County, all the Southern California counties, we cover Smart Care HMO and the Salud HMO EMAS plan. With these two plans, one is lower cost. The Salud EMAS gives you options to travel over the border to Mexico. This is a map of our network and what counties we service. The orange is the Smart Care and the Salud EMAS, and then the green is Smart Care only. As the other plans offer, preventative care plan, care is zero copay, covered at 100%, $15 copays when you see your primary care physician or your specialist. X-ray and laboratory procedures are zero. We offer minute clinics within CVS stores at $15. Prenatal and postnatal office visits are zero. Hospitalization is zero. Urgent care is $15. Emergency care is $50. And then we also offer chiropractic and acupuncture, $15 copay for 20 visits. With the CalPERS plan, under our health and wellness plan, we offer health coaching, quitting smoking programs, and a real age test for your biometric screening. Under HealthNet, we also have the surgery decision program, which is WellVie. That is a good program to use if you're trying to decide if you need to have surgery. Once you complete all of the modules, you'll get a $25 gift card. We also have our nurse advice line available 24/7. We have Omada, which is a weight loss program to help prevent diabetes. We also offer Babylon, which is your 24/7 telehealth service where you could speak to a doctor or a therapist. And then the Minute Clinic, again, which is within the CVS pharmacy stores. So when you join one of our programs, Craving to Quit, once you complete the tobacco cessation program and you complete the health coaching program, you will receive a $100 gift card. I'm sorry, it's not and, it's either the Craving to Quit or the health coaching. If you take the real age test and review the results with your doctor, and then the doctor completes the form online, you will receive a $50 gift card. For Wellbe, once you complete all of the modules within that, a $25 gift card. With HealthNet, we have a dedicated HealthNet website. It is www.healthnet.com/CalPERS. You can get your benefit details. You can find a doctor. You can look at the discounts and programs that we offer. And you can also look to see what decision power programs we offer. To reach HealthNet, you would give us a call at 1-888-926-4921. And just to briefly give you a overview, we also on our website offer a network comparison. On the network comparison, this will identify which plan covers which medical group. So SmartCare HMO will have the check marks next to that medical group, and then the Saluti Moss. We then also have how to search for a provider. If you go to www.healthnet.com/CalPERS, and you click on the provider search, it will preload your plan options if you're already a member. If you're not a member, you will need to know which plan you want to select, if you want the Saluti Moss or if you want the SmartCare. Then we have also our Minute Clinic Quick Reference Guide. That will give you the list of where all the Minute Clinics are in certain counties. We also have our HealthNet's Wellness and Value Added programs that gives you an idea of what all of our discounts are and how to complete the programs. And then here is the information for our Babylon that provides the 24 hours, 7 days a week. No matter if it's a holiday or in the middle of the night, you can actually speak to a doctor. And that concludes my presentation for you today.
Thank you so much, Teresa. So with that, I'm going to ask for Christina Fountain to please take the mic while I share your presentation.
Thank you so much, Katrelia. So I am from OptumRx, and we manage the prescription benefits for all the health plans, the basic plans except for Kaiser or Blue Shield. So the way benefits work, if you can switch the slide. Like I said, we do manage all the basic plans except for Kaiser or Blue Shield. Not all plans are available in your area. So the way your plan works is if you take a maintenance medication, which is any medication that you take to treat an ongoing chronic illness, you want to get it from a preferred 90 pharmacy. All Walgreens and Duane Reads are preferred 90 pharmacies, or you can have it delivered straight to your house from OptumRx home delivery. This allows you to get 90 days of that medication for a 60-day copay. If you don't take anything on a regular basis, you can go to any in-network pharmacy. And if you are very loyal to a specific pharmacy, if they are contracted with OptumRx, you can get a 90-day supply of that maintenance medication. You just don't get a copay savings. As you can see, the medications that are covered are going to be under tier 1, 2, or 3. If you use a mail order or preferred pharmacy for your maintenance medications, you see it's only 2 copays instead of 3, versus if you were to go to, say, a CVS and get 90 days, it's 3 copays for the 90 days. You are allowed to receive up to 2 30-day supplies of a maintenance medication. After that, if you continue to fill a 30-day supply, you could be potentially charged the same amount as getting a 90-day fill. So you do want to get 90 days of a maintenance medication. Example of this is if you fill ProAir for 30 days at your Walgreens, it's $20. If you fill it for 90 days at the Walgreens, it's $40. So it's potentially saving you $80 a year, and that's just on one medication. We have a dedicated website for CalPERS members. It's OptumRx or OptumRx.com/CalPERS. On that website, you can find out which pharmacies are in network, which ones are preferred, price your medication, and check to see if your medication is covered on the formulary. If pharmacies are in network, pick the plan that you're currently enrolled in or thinking of enrolling in, and you can either enter a zip code, city, state, or other filters. You can select advanced search if you want to see which pharmacies are open 24 hours. And it will bring up the list of pharmacies that are in network. Next slide, Katrelia. If you want to price out your medication, you would basically do the same thing. Pick which health plan you're in or the city that you're looking at. Type in the name of the medication and edit the results. Next slide. So that way you are picking the correct strength and dosage. If you want to price out for a 90-day supply at your retail pharmacy, just edit the day supply from 30 to 90, and it will give you the prices at the different pharmacies as well as home delivery. On the medical side, we're used to prior authorizations when your doctor says, I need to run some tests, but I need the approval of the insurance company. The same concept works on the prescription side. Certain medications do need an authorization from the insurance company before it's covered under your formulary. How do you get a prior authorization? You can have your doctor submit one. You can give us a call. We are open 24/7 and have us initiate a prior authorization request to your doctor. If it does not get approved, most of the time it's because we have not received any information back from your doctor, and we will let you know it's not been approved and maybe to contact your doctor for information so he can submit one for you. How do you know if your medication requires a prior authorization? You can look on the formulary drug list on the website, and it will tell you if there's any requirements, coverage requirements, if it's a specialty medication, if it's a prior authorization required, step therapy, quantity limits. That's where you will find that information. We also have a mobile app, which is great because if you're at the doctor's office and he does or she does prescribe you a new medication, you can pull up the formulary while you're there, see if it does have any prior authorization requirements, see if there's a lower cost alternative. And you can have those discussions while you're in the doctor's office on if any of those options work for you. I do find that once you leave the doctor's office, it's a little bit tough to find somebody to assist you with a prior authorization or talking over those options. If you have questions, as we have a dedicated team at 855-505-8110, they are there for you. They are dedicated to all the CalPERS members, so they can assist you with any questions. You don't even have to be a current member. You can say you're thinking of switching to a plan that offers OptumRx, and they can assist you with any questions you may have. Thank you.
Now we're going to ask Karita Hughes from the Health Benefits Unit to please take the mic.
Hi, I'm Karita Hughes, LA Community College District Health Benefits Section, and I am here today to talk to you about eligibility and as well as to provide a couple of screenshots involving the enrollment process, just to make sure we're all on the same page about how to enroll. There are some corrections that I need to make because I apparently agitated the adjunct faculty. And what will happen in this open enrollment workshop is, as I'm speaking, Katrelia Walker will be dropping certain things into the chat so that you can have the most up-to-date information or information based on what I am presenting. The first thing that she's going to drop into the chat is actually this presentation. This presentation includes not only some information on the enrollment process or eligibility, but it has screenshots and images on how to go through the district portal, which I know has been kind of frustrating for some of you. With that said, let's start the presentation. The presentation, since today's workshop has a combination of both adjunct as well as full-time faculty, there are times when I will try to identify specifically who I'm talking to. Obviously, in this case, I'm specifically talking to our adjunct faculty members. The adjunct faculty members must meet certain criteria before they're eligible to enroll into health benefits. They must work a minimum of 3 semesters out of an 8-semester time frame, so basically 2 years. They must have at least 20% of a full-time assignment within the 8th semester or 2-year time frame, and in a 4th semester within that 2-year time frame, they must have 33% of a full-time assignment. I usually send invitations directly to the individuals to enroll, sending a paper application, and it's addressed to that specific individual when they hit that 4th qualifying semester. If you do not enroll when you receive that paper application during the 4th qualifying semester, then you will wait until the annual enrollment period, which is what we're having now, to enroll. In order to take a look or to determine what your subject load is, each subject is different. Each load is different. What I tell people, number one, work with your department chair, but what you do is you divide the number of units by the full-time load for your discipline in order to determine your FTE each semester. Katrelia has dropped Article 13 into the chat. Article 13 is from the faculty contract. It is a list of what a full-time load is for each discipline. You divide the number of units that you're teaching by that list of, by the full-time load that represents your discipline. That will give you the FTE. And again, within a 2-year period, within 8 semesters, you must have 20% for at least 3 semesters, and then in a 4th semester, you will have 33% of a full-time load. And that was just dropped into the chat. And again, I tell people to go to their department chairs if they need additional tutoring or understanding about load. Another thing for adjunct faculty, and this is the big error that must be corrected. A couple of weeks ago, I indicated that if you're 65, you must go with a Medicare program. I got a lot of feedback on that. Thank you guys for being so very vocal. The correction is if you are 65 and you are retired from STRS or PERS, and I include PERS because I know that sometimes we have classified employees who may retire not vested from PERS, but they still teach. So if you're 65 and you're retired from STRS or PERS, then you would not get the POP medical that comes from deductions from your paycheck. You would go onto a Medicare plan separately that is enrolled through CalPERS. I did a evaluation, and thus far I've seen that only 5 people that we're aware of are actually affected by that. So those 5 people may see no plans when they go through the portal, but outside of those 5 people, most of you qualify for the standard POP plan. So that was misinformation that I gave you a couple of weeks ago. I sent an email to all of you. Some of you did not check your email because you asked additional questions that were listed in that email. But again, this is the correction. If you're 65 and listed as retired in PERS or STRS, then you would have to go on to a Medicare program. If you're actively working, not retired, and you're 65, then you're still eligible for LACCD's premium only pre-tax POP plan. With regard to the cost of the plans for adjunct faculty, the district contribution is based on language that is in our contract. Katrelia is going to drop Article 27 of the contract into the chat. This year, the formula equals the district contributing $530.86 from to your medical plan. And a little later on, we will drop what that translates to into actual rates. But this year, the district is contributing $530.86. You will work with your union. You will stay involved with your union to see if there's going to be any last-minute negotiations. Last year, I think the district was only supposed to contribute, I believe, about 500 or 471 or something, 471, I believe. And there was a last minute negotiation where the district contributed $719. That was last year for this year, 2022. So many of you saw reversals of your deductions in January. That was because of the last minute negotiation that was put into play. But as far as 2023, we only anticipate the district contributing $530.86 to the plans. Again, stay in contact with your union for more information. As this workshop has a combination of both adjunct faculty as well as a regular or monthly rate faculty, I want to make sure that we clarify. For monthly rate faculty or full-timers, number one, there's no mandatory re-enrollment. The reason that adjunct faculty have to do mandatory re-enrollment is I am changing the names of the plans to align with what CalPERS, the CalPERS names. In addition to the names of the plans, there are certain codes that are being changed to help with the reconciliations process. I'm not doing it for full-timers. You guys are next year, but this year I'm doing it for part-timers. For full-timers, you already qualify for benefits. You don't have to worry about the math or the portion of a full-time assignment or anything that adjunct faculty have to worry about. And of course, as I will be dropping the rates into the chat for the adjunct faculty, for full-timers, the reason there is no rates for you is because the district contribution covers the full cost of the plan for you and any dependents, spouse, children, or stepchildren, anything like that. It covers the full cost. So there was no need for a rates chart for you. Getting into the portal. I'm not going to go over all of these in details. You will have this. Katrelia already dropped it into the chat. You will disable your pop-up blockers. The instructions for disabling for Chrome, the instructions for disabling for Firefox, and the instructions for disabling for Microsoft Edge. So you disable your pop-up blockers. The LACCD enrollment process has minor screens that jump up to say move forward or not move forward. If you're not moving forward when you click one of the buttons that will go over continue, that means you did not disable your pop-up blocker, and you will go back and pull up the settings to make LACCD a quote, friendly website. So you'll add LACCD's website, My Portal, as a friendly website to disable any pop-up blockers. Katrelia is dropping into the chat the portal access to reset your password. Many of you don't use the portal often. So, of course, you forgot last year's password. So each year you're having to reset the password. This year they changed the structure a little bit. So we are dropping that into the chat to reset your password. Finally, for selecting plans, you will do your research, you will attend the workshops and talk to vendors. You've already listened to the presentations today, and you will go into the private rooms to do a question and answer with each of the workshops. There will be some documents in the portal, including the summary of benefits. I'm going to ask that Katrelia go ahead and drop the summary of benefits into the chat right now. If you click on the document, it will ask you if you want to download that document onto your computer. By now, I'm sure you've already figured it out. On the document, it will ask you if you want to download that document onto your computer. By now, I'm sure you've already figured it out. With regard to adjunct faculty, maintaining eligibility, I check at the beginning of each semester. As long as you're at 33% or greater, then you will never hear from me. If your FTE drops below 33%, but you still have an assignment, you will receive an alternative payment plan. The current payment plan is a premium-only plan that comes from your check, from your warrant. The premium-only plan is what's known as an IRC or a IRC cafeteria 125 plan. And what that means is it lowers your tax obligation. So you really want the premium only plan. And what I tell people, because I'm not great at math, is instead of reporting to the IRS that you made $700 per month, we now report that you made $400 because we've removed $300 to pay for your premium only plan. So this lowers your tax obligation. If you lose access to that premium only plan, then we will give you what's known as an access plan, where a third-party administrator will send billing notices to you, and you use a check or credit card, or you set up a separate payment plan that is not the same as the premium only, that does not have the benefit of lowering the tax obligation, but it still keeps you covered. The other nice thing about access, the nice thing about access, although you lose the tax implication or the lowered tax obligation, the district still contributes to that access plan as if you were working. There are fees that you have to pay because there's a third-party administrator. For instance, in 2023, the district has agreed to pay $530 for adjunct faculty. It will continue to pay $530 even though you're going through a third-party administrator. If you have no assignment whatsoever, then you're offered the COBRA plan. The COBRA plan is the full cost of the plan, no district contribution, plus there's a 2% administrative fee. So as much as possible, obviously at times when you can't help it, you'll go into COBRA, but as much as possible, your union has negotiated the best that they can to give you the best possible benefits with the access plan. The access plan started in 2018. It's an excellent alternative if you can't get the POP plan at all. For adjunct faculty, the rates can be a mystery. If you're continuing from a fall or enrollment, in January, we have what's known as a January adjustment. That adjustment is a slight adjustment simply because the plans go up in January. So you will see a slight increase in January. Very seldom do the plans go down. You'll see a slight increase, but that's a January adjustment because you're continuing from the previous year. If you're enrolling for the first time, you've never had benefits, you're going to see something that scares you. On January 31st, you will see a large deduction. The reason you see that large deduction on January 31st is because you're paying for the months of January and February. So you just paid 2 months instead of paying 1 month. And because of the way we have to do the deductions, we took it in one check, 2 months in one check. It does eventually even out to the things that we advertise, which is a slight increase to keep you covered during the summer. And the reason we have to do what's known as a 10th deduction, or funky math as I like to call it, is because for the most part, many of our C-basis employees do not work during the summer, July and August, so we don't take deductions during the summer. As a result, we prorate your salary to keep you covered for July and August. We also do the same thing to keep you covered during the winter intercession. So that's why the math is a little off for adjunct faculty. Again, full-timers, don't worry about this. So for adjuncts, that's the math that you'll have to deal with. With regard to going through the portal, you've received several emails that include the links to the portal, and I just want to make sure that I clarify what it means to, quote, go into the portal. As I indicated, for full-timers, we're not making the changes for you this year. So as you can see on the screen, you will see no changes from the previous year. And for a full-timer, you can go ahead and click that, and you can print out benefits confirmation. But as you can also see for adjuncts, you're not eligible to skip steps. So adjunct faculty members will actually go to start your open enrollment. You are not eligible to skip. What will happen is if you are not in the Region 3 plans or the new plan names in 2023, once the portal closes in October, when I get an opportunity, I'm counseling anyone who did not go through the portal. You will be without benefits. So adjunct faculty must go through the portal to get the new plan names and changes. And right here, before we move forward, I do want to say that for full-timers, although there are no changes, so you can pretty much skip this step, the step of going through the portal. If you have a flexible spending account, you will have to go to the third-party administrator's website. And I make sure to include that in our emails so that you can just click directly to the third-party administrator rather than going through the portal, because I know you guys hate it anyway. So if you're only changing the FSA, which sends you to the third-party administrator anyway, then you don't have to worry about going through the portal. For adjunct faculty, we've already discussed that you will go through the portal and you will click Start Your Open Enrollment. If you click Start Your Open Enrollment, a dialog window shows up. You click Continue. If after you click Continue, that dialog window does not move, that means that you did not disable your pop-up blockers. So you start from the beginning of this presentation. You'll go back, you'll disable pop-up blockers, and when you click Continue, it will show you your 2022 plans, and you'll skip Continue. You'll go to the dependent list, and I'm not going to go through this as detailed as it looks like. I'll go through it. You'll make sure that the dependents are listed. If you have no dependents, obviously you continue through. If you're adding dependents, be sure and submit the supporting documents necessary to add your dependents. You can also read the frequently asked questions if you have additional questions that are the frequently asked question, I hope, can answer some of those questions. This I just said, it's for those of you who take the presentation home, I just said these things, but I do want to say one thing. Sometimes when you look here and there is a dependent on your plan whose social security number or date of birth is incorrect, you will attempt to change the social security number or date of birth. Do not do that. As bullet point number 3 indicates, you changed any of the dependent demographics, it locks the dependent, and it will remove the dependent from the file. So when we do our file transfer to CalPERS, because it's locked, I do try to do a check to see who's locked. But if this continues to be locked when we do our file transfer, then the dependent is not added to the plan. So please do not use the portal to update dependent demographics. You're going to send a social security card or a birth certificate or something like that to make the correction that you need. It needs to be made by HBU staff. You're going through the portal. Again, you're choosing your home zip or your work zip. It will show you the plans. You will click which plan you want. You will look down and make sure the new dependents that I added are not on the plan yet. So you will make sure that you add those dependents to the plan by clicking check marks next to their name to make sure that they're enrolled. You will do the same you will click Continue. You will accept the change of adding those dependents, and you'll do the same. You'll repeat those steps for dental and vision. For adjunct faculty, full-timers have always had this as part of their benefit. For adjunct faculty, your vision plan, you're not going to see a CVC here. It's just been added to your standard vision plan so that on January 1st, you will have computer glasses available to you. Standard glasses for distance, computer glasses for obviously working on your computer. We refer to them as CVCs, and it's kind that we'll call them computer glasses. Technically, they're reading glasses and bifocals, but I reject those terms. So adjunct faculty, if you have the vision plan, your computer glasses will be waiting for you on January 1st. For full-timers, they're already available to you. If you don't already have them, you'll shoot us an email and we'll make sure you get them. or you can go for full-timers, you can go through the portal and just add them. In the past, we've requested verifying documents, but the union has negotiated at the union, and I believe Katrelia was part of the discussion, that everyone is now using the computer more than usual. So everyone is eligible for computer glasses. We no longer require that you verify that information. You'll repeat the steps of enrollment for life insurance and pet insurance. You'll either add or waive. In this case, I'm just giving you a sample. Each option has the opportunity to waive coverage if you're not interested in one thing or another. So you can waive coverage. And if you're just wanting to waive for 2023, you'll go through and you'll waive coverage. Once you're done going through the portal, you'll get an opportunity to review your 2023 selection. You'll continue through the portal. You'll submit your benefits enrollment. And for some reason, once you submit the benefits enrollment, it gives you the opportunity to do the CalPERS confirmation. And then it asks you if you want to change your marital status. That annoys me that that's there, but you may choose to change your marital status or not. And if you change your marital status, you're stuck in this big bar where you have to X out. It doesn't have a continue or anything like that. So once you change your marital status, you X out. You will receive a CalPERS enrollment confirmation. This is important. There are two types of enrollment confirmations that you receive. CalPERS enrollment confirmation is the one that I need with the Health Benefits Unit. I am not interested in the LACCD enrollment confirmation. The reason I need the CalPERS enrollment confirmation is in case there are any errors, we will have this confirmation showing that you went through the portal during open enrollment, so the file errored out. We need to have this correction made. You will submit the enrollment confirmation to the Health Benefits Unit either by email, by courier, or by U.S. mail. Obviously, I prefer it by email or courier. You'll submit this plus any supporting documents upon adding a dependent. And that's it.
Okay, so with that, we're about to move now into the breakout rooms. I will drop the Actives one here, and then